Hi, good afternoon, everybody. This is Eric with American Business Systems, and I want to welcome you this afternoon to our weekly Wednesday webinar. Now, okay, so everybody say that fast, 3 times fast. Our weekly Wednesday webinar. So thank you for joining us. Today, what we're going to be talking about is what business can see ROI in less than 1 year. So Patrick and I are going to be talking with you this afternoon and going over all that information with you this afternoon. So again, my name is Eric Auger. I'm one of the business coaches here, and we'll be happy to help you this afternoon during our webinar. Let me, first of all, I'm going to introduce to some of you, this is your first time to be on any of our webinars. Those that have been here, you've kind of heard this already, so just bear with us as we kind of go through this little introduction. But for those that are looking to get involved in not just a medical billing, but any business opportunity, you want to look into how long has that business been around. Well, ABS has been around for over 28 years, folks. That's a long time to be in business. ABS is the largest network of independent medical billers. And so what we want you to do is become plugged in to us. I mean, that's what we're doing here. We are powered, all of us here at American Business Systems are powered into a lot of different areas. And so that's what we're going to kind of show you here. If you haven't been out to our website, we've got a brand new website. You can see some information out there. One of the things that we are listing on our website right now is how ABS is plugged into and partnered with some of the biggest names in the industry, folks. As you can see here, ABS, your investment includes partnerships with industry-leading billing and complementary software services to help you build a business. Imagine you trying to start a business and trying to pull all this information and pull all these alliances together. Well, that's what ABS has already done. And so with these alliances and with these partnerships, you are going to be well ahead of any billing company that's out there. So go back there and take a look and see some of those other ones. Our iClaim and EMRX platform is actually powered by NextGen. So folks, even though that it's named iClaim and EMRX, it's white labeled for our ABS licensees, but the engine back behind it is none other than NextGen Healthcare. So we are so glad to have that partnership there. And you talk about give you such comfort to know that we are industry leading in our software. That's one of those things that you really, really need to be thinking about. Now, again, ABS started over 28 years ago. This is a picture of Patrick and Linda Phillips. They are the originators of American Business Systems. Actually, Linda is the one that actually got everything started. But Patrick from there has learned to help build a business for people like yourself. He's written several books. One, How to Reprogram Yourself for Success, is actually his story of what took him from really not having more than $10 or $15 in his pocket to where he is today. And so that's a great book to have in your library, just as a kind of a, not necessarily self-help, but it actually shows you how to reprogram yourself for thinking successfully. And then the new thriving medical practice, we're going to talk a little bit about this afternoon. So we'll talk a little bit more about that book. Now, the reason I'm showing this picture is again, obviously these two guys here. Obviously on the left, you see Patrick, and the little guy there is Adam. Well, you see them over on the right-hand side as father and son working this business together. There's not a lot of families that can actually do that, but Patrick and Adam have been very successful at that. And the reason I shared this with Adam, with you, is that you see here that Patrick is the founder and Adam is the CEO of American Business Systems. And Adam has also not only written articles for a magazine called BC Magazine, which is a billing and coding magazine. He's also helped write and co-write and author a book called 9 Ways Doctors Let Money Slip Through Their Fingers. And that is co-authored by Dr. Vicki Rackner. And you're going to want to pay attention to that because about Dr. Rackner, because next week, I'll give you kind of a prelude, we're actually going to be interviewing Dr. Rackner next week. Now, what you're going to get with your investment here with American Business Systems is all of this and plus more. That's what Patrick and I are going to talk with you about this afternoon, is all these different services, how they all work together and help you build that business. So I'm going to say without any further ado, I'm going to bring Patrick on here. Patrick, are you there to join me this afternoon? And as you do, make sure you hit your mute button on there so that you're ready to go.
Oh, you got me under control. I just do whatever he says to do, folks. And, as you can see, if I didn't have him, I probably would not have pushed that unmute button.
You'd have to do the same thing for me. I mean, that's what we do. Patrick, I mean, gosh, you and I have been doing this since we both had black hair, I think.
Well, that was a long time ago for me, back in my late 30s, I think. Well, Eric, this is a great topic too, because a lot of people don't realize that it does take a couple of years on average for most businesses to get to that point where they've got a return on investment, ROI.
Yes, I found this article as I was trying to do some things on the internet, try to find some, how long does it take to become profitable, especially with a small business? This is also obviously dated a couple of years ago, but you and I have known this for a long time. I think most of the people that are on the webinar know that it normally takes 2 or 3 years for a business to become profitable on average. And that's where you kind of break that threshold of a return on investment.
Yeah.
So, yeah.
Well, and you know what? A lot of people don't realize that it does take that long, a couple of years, and people are thinking, wait a minute, shouldn't I start making money when I first open my business? But folks, there's a lot of investment in most businesses, especially a franchise or a business opportunity licensing situation like we have. There is an upfront investment, but that's what it is called, an upfront investment. That's because it takes some money for us to run our company, to keep the support going on the back end, to update all the software and the coding and so forth. That's right. All covered by those upfront fees.
That's correct.
Yeah.
And I think a lot of people don't even consider, some may do, but the investment of time, the investment of your marketing, of what you got to do to become successful.
Yeah.
And ABS has kind of taken some of that equation out of the picture, because you start off with marketing material and you start off with the book that we're going to be talking about here in a little bit, and some things that can actually shorten that gap. And so what we're going to talk with folks about is how a business like American Business Systems that can offer to you, many people can find their return on investment in less than a year. And we're going to show that to you here in a moment. But one of the things that I wanted to kind of talk about, now we shared this last year. Now, this is information that was given to us on doctors that are on independent practices. And this is 2021 information. But it says, Patrick, that 75% of practices expect to grow in 2021. And we can see that even in some of the other reports that we take a look at, go way past 2022, all the way into 2028.
Yeah, this is a great thing that you found here, Eric, because 75% of the practices expected to grow in 2021. And that's what happened. Now,
right.
Here we are in 2022, and I hate to even say anything about the pandemic, but it looks like it might be winding down.
Yeah.
If that's the case, then probably even a greater percentage of doctors expected their practice to grow here in 2022, and I'm sure that they will.
Yeah, absolutely. And for the conditions that help that, with some of the things that are driving that, again, is acquiring new practice, new patients and recurring visits, and providers believe in the future of owning their own practice. That's where this information is really going towards, because a lot of people think, gosh, aren't doctors not independent anymore? Are these providers already in business with maybe large hospitals? And yes, hospitals have physician groups, that we know, but there are plenty of people, doctors that are out there, men and women, who want to have their own practice, their own independent business, just like you do.
Yeah. Well, and look, I love this this quote right here, Eric. If you look at the end of that last paragraph there, it says that doctors are looking, to provide a greater level of personalization and responsiveness to patient needs, and have a lower average cost per patient. Fewer preventable hospital admissions, lower readmission rates, than larger or hospital-owned practices. So this is the move right now. It's just incredible. You and I saw the move, maybe 4 years ago, that doctors were starting to be acquired by the big practices and hospitals. And now the doctors are realizing, you know what, that wasn't such a good idea.
Absolutely. Yeah. So this is that statistic there that's in that article there. It's just kind of showing that, how important is each initiative to practice growth. And, a lot of them want to acquire new patients. Now, we've got one of our programs here that we can show doctors how to actually increase new patient growth and what they can do to get their patient referrals back in and how to get found online. So a lot of this stuff that we can actually show in and through our entire system here, Patrick. So that's the benefit. We kind of wanted to show you, some projected information of what we just went through. There's still that growth that's happening here in 2022. I think we're going to start to see again, coming out of this pandemic, that these doctors are looking forward to get back into business and everything else that can be done from here on out.
Yeah, it's a move, I think, on the part of the doctors to have more independence, more control over their own business and life. And so this is a good thing for all of our business owner licensees.
Yeah, absolutely. Now, let me remind everybody again, you can go type in some questions as we kind of go through this little bit of an introduction, but we're going to show you here real quickly how you can take your investment from ABS, your $28,990 investment, and how can you get that return on your investment back within a year. Now, let's start first off talking about the money it costs a doctor to do billing in-house versus having it outsourced to somebody. And Patrick, you've used this several times, and we've talked about it several times, but if we think about this, 24%, and that's 24 cents out of every dollar is being, I don't know if you call it wasted, but we call it wasted. But the doctors may not call it waste because they don't even know how much they're spending.
No, they have no idea. Now, this next chart that's coming up will show that. And this is just incredible when you take a real good look at this, folks. By the way, if you want a handout of all of these slides, all you have to do is ask the person who invited you to this webinar. Just ask your ABS rep, and we'll give you the phone number and the email address here at the very end. But you could ask for this. And look, on the left side, this is what it would cost the doctor in-house. That means inside their own office, hiring their own people at $15 an hour. We've got all the numbers that you can look at there. Bottom line is, it's $48,000 less expensive to just hire this done outside the office.
Absolutely. So folks, again, if you want this chart, we can certainly help you get a hold of that, and then we can share that information with you. Now, Patrick, with their investment here, we've talked about it briefly already, that it's $28,990. This is the information I mentioned earlier that about marketing and kind of shortening that gap about marketing. And you have all of these marketing pieces that you've created for each business owner that comes into American Business Systems.
Yeah, over the years, we had various licensees come to us, our business owners, and say, look, Dr. Jones wants to know if we have something that can help with their collections for, the money that patients owe them that they haven't paid. Well, that's how we came up with the Quick Collect service, for example, and the Choice Pay service. There's a reason for every one of these, but Eric, the great thing is that our licensees get all of these services in our package for that one lifetime licensing fee of about $29,000. Now, it doesn't mean that you have to offer these. These are all optional, but some of them, I think they'll want to, won't they, Eric? There's money to be made with these.
Yeah, you bet. And what's great about it is that each one of these is to help support you on Friday afternoons for our business owners. Typically, we'll take one of these services and refresh your memory on it, and we'll even show you how to market that to a potentially group of doctors. So I think like this next coming Friday, just a couple of days from now, I can't remember which one it is, but one of these is being kind of refreshed and retrained. Even though that you go through all the training here at American Business Systems, there's continued training. There's other ways we're showing you how to build your business, how to increase your market share out there. And folks, that's all inclusive with your package here. You don't have to pay another dime to go through all of this training and keep that going. That's where you're going to find your success here.
Yeah, this Friday is on one that's not even listed here, Eric. It's a brand that we don't talk much about, but it's on the credentialing. What
there you go.
Yeah, if you need to help a doctor get the paperwork done between him and Medicare and the insurance companies, there are people who can do that for you for a fee. You outsource this basically to another one of our licensees who specializes in credentialing. And you're going to hear all about that and how that works.
Absolutely.
You can offer that to your doctors and make money and open doors that you might not otherwise be able to open. All of these, Eric, are door openers, aren't they?
They are door openers. That's what any entrepreneur wants to have is a multiple set of ways to get in front of that doctor.
Right.
Now, so today, the rest of this afternoon, probably for the next 40 minutes, what Patrick and I are going to kind of walk through you on is actually the math of how to take your investment and then what's it going to take how many doctors is it going to take for you to actually get to what we call kind of break even here. Everybody's looking for how can I get back up to what I've invested, and then when can I start making some money? And that's what we're actually going to look into. So let's start off right here with this first thing. So Patrick, a lot of people may not even know what an ROI is. You want to kind of talk about what that is?
Yeah, it's how quickly you can get your money back on your investment in a business. And so basically, you invest money and then you get a return on the investment as you run the business. And most people don't realize that a lot of businesses don't see an ROI for up to 2 years after they start the business. With ours, it's a lot quicker.
What would you say? I mean, everybody knows the sandwich shops that are out there. We don't even just say sandwich, which one it is, but typically, how long does it take to get an ROI, your return on investment with let's call it a sandwich shop?
Well, I have a friend, a friend who just a few years back actually opened one of those sandwich shops. And, their radius, their territory is only about 2 miles around that shop. And then the company itself can open up other, sandwich shops. And so you can have competition real fast, even within a couple of miles. But it took him, Eric, 2 years to realize that he probably wouldn't see a return on his investment in the first shop as quickly as he thought. So he opened up another one, and then another and another and another. Yes, this guy now has 5 shops. Had to get to that point where he was making, his, I don't know, he had a goal of 150,000 a year or something like that. It took him that many stores to get to that point. With ours, you don't have to worry about that. It gets a return a lot quicker.
Yeah. So we're going to talk about what the investment is, how quickly you can get that return, and then where you find success. Because what I call success and what Patrick calls success can be 2 different things of what you call success. Some people here that we've kind of gone through at American Business Systems, some people, just getting through the training is success in and of itself. That's a great way to think of it. But most people think that success is I've got my first doctor and I've got my return on investment at the same time. And that's what we want you to kind of see the calculations on that today. So the first part of all of this, Patrick, let's kind of talk about what is the investment, and then we're going to talk about really what they all get with that right at the first. But the investment is now at $28,990. Patrick, a lot of people are probably looking at a lot of entrepreneurial websites and franchises. Where does that $28,990 kind of fall in line with other business opportunities out there?
I don't know many out there, Eric, that are that low. I mean, most of them are above that number of 29,000. Some of them up to 75, 80, 100,000, depends on the franchise, right? But for us, we decided that if we can keep this below 30,000, you see, that's 29,000 basically right there. That actually gets people to the point where they can round that up if they want to 30,000, and you won't find anything out there in franchises and business opportunities for less than 30,000. That's kind of like the bottom line number.
Right.
For us, that is the key, is keeping that low enough to where enough people can get involved in the business to actually have us the coverage that we need. Because Eric, it takes a lot of people doing a lot of billing for a lot of doctors. There's almost 1 million medical providers out there.
That is correct. One thing that I can say about ABS, it hasn't raised its prices like the grocery stores have on their chickens. I remember last year buying a chicken for $3 to $4, and now if you can find a chicken, you're going to pay $8, $9, or $10 for a chicken. So the percentage of buying chickens have gone up in the last year, but ABS has only gone up $1,000 from last year to this year. So
well, and the only reason we did that, Eric, is because we keep adding new ancillary services that, like you saw last year, we added dental billing, for example, to our package. We increased it a little bit there to cover our costs with that, but not what you would have paid had you opened up a separate business doing billing for dentists.
Absolutely. So let's talk about the return of what you're thinking of. Typically, after you get your first doctor, you're going to make anywhere from $30,000 to $39,000 in your first year of doing billing. Now, again, obviously, I preface that of after you get your first doctor, and that's always the important part of it. But even after you've gone through training and you get through the first couple of months while you're trying to do your marketing, you still may see your first return start even getting into that 30 to 39,000, and that's low. And we're going to show you those numbers here in just a second.
Yeah, Eric, we came up with this because people would ask us, well, how many doctors do I need to have? I mean, how big do I have to build this business? Well, folks, literally, as you can see, your return on your investment can be more than that licensing fee of $28,990 with one doctor. And how do we get there? Well, we have a spreadsheet that we're going to actually let you get from us that you can plug in your own numbers. But Eric, let's show that and kind of zero in on those numbers there for that spreadsheet.
Yep, let's do that. You want to kind of walk through that, Patrick?
Yes, and I'm going to get a little annotation drawing thing here, right here, so I can kind of zero in on that. Let me, let's see, can I increase the size? Yeah, okay. All right, so folks, let's talk about the 7% here. Where do we get that? Well, that's the billing rate that you're going to bill the doctor for doing his or her billing, right? That's what you charge the doctor. And the normal range, as you can see, we're being straight up with you here. In some instances, depending on the doctor, depending on the specialty, depending on the volume, it could be as low as 4%. We've seen that, Eric, in the past. Usually that's a mistake to have it that low, but some doctors may be doing billing with some other company and they think you need to compare with it and compete with it. And so it could be as low as 4%, but we've got licensees who have gone up to 8%. Eric, I've actually seen 9% and 10%. So it just depends on the doctor and the situation. We can help people decide what that should be. That's part of our support, of course. Then the $100 average claim, Eric, I don't know the last time I went to a doctor that it was less than $100. That's pretty typical nowadays just for a visit. If you have a typical visit with a doctor, even a general practitioner, you can pay $100 for one visit. Typically, it's going to run $800 up to $200, depending on if it's a specialist, of course. But that's the common number there. Yeah, 800 to 200,000, 80 to 200,000. And then we put the number of patients at 20 here because that's a low number really for most doctors' offices. If you were there during the entire day, you'd see probably closer to 30 patients come into most doctors, depending on how many providers are inside there. But that's a good number. And using these numbers, our calculator has come up with a yearly potential income of $36,400, Eric. That's a pretty amazing number if you think about it for one doctor's office.
For one doctor's office. And so the reason we're showing this to you and we're keeping those numbers as low as possible is to let you see that a normal doctor that's going to see 20 to 35 patients a day obviously if they're seeing 35 patients a day, you're going to quickly be $40,000 to $45,000 in a year. And still at the investment of $28,990, you clearly see how even if you got started a little bit late in the year and you're going to try to catch up, you're going to find most doctors are going to be probably seeing about 30 to 35 patients a day, which will kick that number up. And then getting your return on investment could be about 7 to 8 months after you kind of get things started there. So I'm going to erase these drawings there that Patrick had there, and then let's move on to the next slide.
Eric, before you go on, let me get a question here that came in.
Sure.
Darcy has asked a question: is the average claim, that's that $100 you see there, folks, is the average claim based on billed amount or the amount paid by the insurance? Now, folks, we're using the amount that you would actually collect for the doctor. That's the actual claim amount. It can vary widely, of course, but that's $100 collected from the insurance company or from Medicare, because the average claim can run $180 to $200. So we just kind of took a low number, but a round number to make it easy for the math there.
Yeah, and so what Darcy's asking is, it sounds like she's got a little bit of medical billing experience, is that when you actually process that claim to like Blue Cross Blue Shield or Medicare or United Healthcare, you're probably billing out $125, $135.
Right.
But what they actually get back in their contracted rate with those insurances usually is going to come back on average about 100. So if you take what Medicare reimburses, Medicare may reimburse 85, but Blue Cross Blue Shield may reimburse 115. So it just depends on all that. So what we do, Darcy, so basically what you understand is we've just taken an entire billing cycle and just said, okay, averaging all of those out, that's what comes out to be about $100.
They're just round numbers. You shouldn't take these as the numbers that you're going to have for your doctors, because all doctors are different.
Yeah, absolutely. So what we wanted to do is, where's the math behind all of this? That's what we want to kind of show you. So what we're going to do here is just kind of step this thing through, that if you got one doctor who will see, again, on average 20 patients per day, each one of those patients is valued again at about $100 per patient. Obviously, that's about $2,000 per day that a doctor's looking to get. Now, most of you are thinking, man, the doctors are making a killing at $2,000 a day. I wish I could make $2,000 a day. Well, understand, they've got offices and bills that they're paying. Probably they're trying to still pay off, college and everything else, but
salaries.
So, yeah. But imagine if that was 35, now you're 35 patients, now you're at $3,500 a day, and you can still do the math there. So if you take your potential daily earnings, what you're going to make, if you got the $22,000 per day at 7%, that comes out to be about $140 a day that you're making. And we want to kind of stress how long it actually takes you to do this. Patrick, it normally takes you less than 2 hours to do the billing for one doctor.
Yes, because each claim can take you only a couple of minutes. If they're initial claims, they may take a little longer because you got to put in some patient demographic information. But we've just found from what the licensees have told us that this is about what they make per day, $140 a day for 90 minutes of time. Folks, that's pretty good hourly wage.
Right. And most people can sometimes do this on a part-time basis. Again, if you're able to get a doctor there. But you take that $140 a day times 5 days a week, times out there, times 52, that's $700 per week times 52 weeks. There's your math, 36,400. So that's it. So you can see pretty quickly with a doctor that is really not seeing a lot of patients, how you can actually get your return on investment, again, in less than 1 year.
Now, Eric, let's talk for a second too about what is the potential for one person doing the billing for doctors, just working out of their home, in kind of spare time, if you think about it that way. What could they earn if they got to the point where they had 5 doctors? And that's a very reasonable number, because again, 5 times 90 is, it's not many hours. I don't know what that is.
But if you're serving 5 doctors, which again is on average what our licensees are doing, their income potential earnings is about $182,000 a year. Now, give or take a little bit, because again, some doctors won't have as many, have big of a volume, but we've seen some of our licensees actually get a group of doctors of 3 to 5 doctors right off the bat. And all of a sudden, their return on investment may be in the next 2 to 3 months, which is off the charts of what you're thinking about, of what the article that we showed you earlier from Freshworks. Typically it takes 2 to 3 years to get a return on investment. And even if you start this business, and this, let's just set the correct expectation. Even if you start this business and you go through training, and it's still 2 or 3 years that you get your return on investment, you're still within the scope of what most businesses actually get their ROI on. So that's why we continually, week after week, on our Friday webinars for our licensees, is to keep this momentum going for them, because some need a little extra help and they just need the encouragement. And so we're here, been here for 28 years plus already, helping our licensees get and to achieve their ROI as quickly as possible.
Yeah, so that 182 that you see there, folks, of course, is a gross profit. You're going to have some costs there, of course, for doing that, but still, that's more than most people expect from a Subway sandwich shop, or even Eric, even McDonald's owners don't expect that kind of money the first year.
Right. Yeah. If we took the percentage of investment to potential earnings with just 5 clients that you would typically get, which would be 5 doctors' offices, that percentage is just, it's unbelievable. And that's why we say here at ABS, we are still probably the best business opportunity out there, under $30,000 out there, for the potential money that you can make here. And not only do we have people making 6-figure incomes, obviously there are some that are making 7-figure incomes, but they've been at it a long time, and so they've got a good foothold in their area. So those are some of the things you can be seriously thinking about.
Eric, we do have a question here from Hamid. Yep. Says, would you please point out our costs? Now, in this particular webinar, sure, Hamid, we're not going to go into detail about those costs, but in general, we can speak in general terms, because we know, after being in business for 28 years, that the average licensee is going to spend somewhere around that 182,000. They're going to spend somewhere around 20% of that probably for their costs. So whatever that is, Eric, 80, I haven't done the math on that, but 80 times 182 is what? 80%.
32,000 maybe in cost.
Yeah.
And that depends if you've hired people, doing the work for you. Obviously, you're going to calculate all that information. But let's just kind of just drive it down to the one doctor there. If you're doing it, you're not having to hire anybody out. You're doing it all on your own. You've included the cost of some of the any of the softwares that the doctors might need. You're including all of that in your billing costs. Really, there's not much more cost. I tell you, the biggest cost that you'll have is your time investing in getting your first doctor. That's really where your costs are going to be there. Yeah. Now, obviously, there are some percentages of costs that are going to be going through it, but again, to get to where you need to return your return on investment, they're so minute.
Yeah. So Hamid, the answer is your costs are going to run somewhere around, for a medical billing business like this, somewhere around 20% of what you gross, because you've got all kinds of costs behind the scenes that you might not be thinking of. To host a website is $10 a month. For example, if you do any kind of advertising, you're going to have some costs involved in that, even with our AutoCard system that does some marketing for you. There are costs, but we've kind of factored those in. So I just did the math on that, Eric, and it's you end up 80% of that 182 is 145,600 that you would be putting in your bank account.
Yes, absolutely. Yeah, and that's again a very good living for most.
Now that's if you're doing the work yourself. If you hired somebody else to help with that, you've probably got another $35,000 behind the scenes that you would pay a biller to do the actual
Right.
billing. So now we're down to $115,000 that you would net. But as a business owner, you always have some costs. And yes, you need to figure those in there. So I would encourage you, Hamid, to get back with the person who invited you to this webinar, your ABS rep,
Right.
and just ask them to give you a breakdown. Now, one of the things we're going to show a little bit later is a medical revenue management research guide that you can download that breaks down those costs in detail.
Absolutely. And folks, if you think about this, most doctors, this is their average income after they're doing everything that they're doing. They're going to be averaging $120,000 to maybe $250,000 a year.
Yeah. Uh-huh.
And you can just see, servicing 5 doctors, maybe 8 doctors at a time, you're going to be at their same level of what they're making. And again, you may have a little bit of a staff too as well, but you can see you didn't spend millions of dollars going through school like they have, and medical malpractice that they have to pay, and everything else that they're having to pay to get up to what we would consider to be a physician level income. You know,
we have, in fact, I've interviewed licensees, some of our business owners, Eric, that have told me outright that they know what the doctor is making because they obviously have access to all of his numbers, and that they're making more than the doctor is. So,
yes.
And this is assuming that you only want to work with 5 doctors, Eric. We have licensees who have over 100 doctors.
Correct.
So again, it depends on your thinking. How big a thinker are you? How big do you want this to grow? How many people do you want to hire and deal with? All of that's involved in this, but we're talking about one person in your spare time almost could be serving 5 doctors.
Absolutely. So for the investment here, the $28,990, what do you get? And so this is a question that we've gotten asked on many, many, many different webinars. And we thought we would just share this since we've kind of gone through what kind of business will see their ROI in less than a year. What are you getting for your investment? So that's what we want to kind of take you through here. And some of these, again, are good money makers in and of themselves outside of the medical billing. So obviously the first you're going to get is this integrated cloud-based system. And again, we shared this with you that our iClaim EMRX is one of those systems that are out there that just nobody else can touch. We've got great support. We've got a great backing, as mentioned earlier, that it's powered by NextGen. So what we have here to deliver to these doctors is far greater than what most doctors are going to get because of the support that you're getting from not only ABS, but from all of our technology partners.
Yeah, and these are the 4 pieces of the puzzle that everybody needs to be able to run something like this, Eric. The amazing thing is that we have competitors who do something similar to what we do that don't have all this built in. They're certainly not integrated in one tightly knit, a company who programmed everything system like we have.
Correct.
Because being cloud-based, we can have all of this, the iClaim system itself, which is the practice management system that actually does the billing, the electronic medical records for the doctor's use, the clearinghouse behind the scenes that does all the claim scrubbing and submission to the insurance companies, and then the patient portal. All of that happens to be integrated in one system written by one group of programmers. We have all of them in one office in California, and we throw them some Pepsi and pizza every once in a while, and they just continue programming.
Some of you may have seen this illustration before. Again, we've got so many people that are new on here, but what I'm going to draw around here, I'm going to take all of this area that's in this part of the, kind of went off my screen there a little bit. All of this is all one system. Typically, what you're seeing with a lot is that you might get this as a standalone product. You might get an EMR system that is a standalone product.
Right.
You're getting a billing system that is a standalone, and then a clearinghouse. And then you're having to match all of this together. Okay.
Yeah.
What we're able to do because of our total integration is that this allows us to put all of this together here. Whenever you, as the billing company, press that button there, that creates a claim, that whole claim, create a claim, that's right there. When you create a claim, it's not going back through some third-party clearinghouse that's sitting like way out here, in Timbuktu. It's within the system. So when you create a claim here, it's going directly to these insurance companies. And that's what you want. You want full control and full access of when that claim is processed. You want to know if there's any errors before you actually submit a claim. You want to see all of that, before it even gets to the insurance company. That's why we're able to drive down what is known as rejected claims. And we are less than, let me see if I can do that, less than 2% of rejected claims. And the reason we're able to do that is because of our integrated system that we have over here.
Right. And Eric, the typical system that's out there that's not cloud-based like ours is, because the clearinghouse is a separate entity, that third-party entity, that can sometimes run 25 to 30% rejection.
That's correct.
Initial claims, yeah.
Yep.
And
absolutely.
So that's money left on the table that you can collect for the doctors.
So again, what you're getting is not only the iClaim platform, but every piece that we're showing you here. We have a marketing piece that is a flyer slick, very nicely, heavy, thick paper, glossy paper that you're able to coordinate with what your services are and the services that you have. And on each of these, you can take each of these flyers and customize it with your name, with your contact information directly on each of these flyers. So you're getting one for iClaim, you're getting one for electronic medical records, our EMRX system. And then with all of these other systems, and like you said, Patrick, this Friday we're doing one on credentialing. We don't even have a flyer for credentialing, but here we are, we're adding stuff and I can't even keep up with everything that we've got going on.
Well, what is that right there? That's 12 right there. So there's our even dozen. I guess we ought to just stop, huh? Because
yes.
over the years, of course, we didn't have, any of these. We just did the billing and showed people how to do the billing. But then we had licensees coming to us saying, look, the doctor wants to know, what can they do for getting new clients, new patients? How can we help them with their marketing even? Yes, so we came up with AutoCard, for example, for that. There's all kinds of things here that's listed that, yes, they're all optional. You don't have to offer any of these to a doctor, but if you do, believe me, doors will swing wide open for you.
Well, I'm just going to kind of go through a couple of these because we're starting to get ready to wind down here. We got about 15 more minutes left. Quick collect. Patrick, the questions have come in before about, am I going to be in the collection business? Am I going to have to call little old ladies and tell them that, Julio's going to come get them? I hope I didn't have a Julio on here on the webinar, but you know what I'm talking about, Rocky. Yeah. Rocky's going to come get you here and come knock on your door and say, hey, we need to get you. You need to pay that doctor. So
this says, this is totally automated, folks. We have this completely behind the scenes. Our system is actually sending out things that help collect that from the patients without you picking up a phone one time. And it can collect up to 3 times what a typical collection agency would normally collect, Eric. That's the amazing thing. And we do that without making the patient mad.
Yeah, absolutely. Yeah, we don't want to make the patient upset. And then Patrick's already talked about AutoCard. AutoCard is a marketing genius system here that can be used for you as a potential. You're trying to get new doctors because we have personalized marketing cards already for you just to put your name on and get that out to, like if you're going to send out some mailers, but we can do the same thing with doctors. If a doctor wants to generate more referrals coming in or patient reminders of annual visits or whatever it might be, maybe a new service that the doctor has and they want to send that out to their patients that they've got a new service there. AutoCard can help generate that that personalized marketing material for the doctors.
Yeah, and then the licensees can also use this, of course, for automating their marketing to the
Correct.
doctors themselves. So you're right. It's an ingenious system, Eric. I wished I had come up with it. We didn't. We partner with another company on this one. But the point is that this is totally automated. Once you put a patient into this system, they're going to get that postcard or greeting card every month or however often you set it up for that particular doctor's office. It's just an amazing automated system. I wished I'd come up with it. It's intense.
Now, this is where most people kind of start thinking about, oh my goodness, whenever I get involved in this whole medical billing thing, that means medical codes. Do I have to become a coder? The next two services that we're sharing with you has to deal with codes. The
Right.
first part of it is Medicare is always doing these audits on doctors. And what they're trying to do is they're not just trying to catch the doctor whether they coded right or wrong, but they've got to do their own audits to make sure that everything kind of stays where it needs to stay. Well, you can offer doctors what's called an audit guard. It's like a go in there and let's do a pre-audit before Medicare looks at you. And this is all done by certified medical coders. So this is something you can walk straight out of training. Think of this. You could walk out straight out of training. You can start marketing this to doctors without even starting to do their billing, because there are going to be some doctors that it may be under a Medicare audit or a Blue Cross Blue Shield audit or whatever. So, and these doctors know that they could be fined up to $10,000 for each infraction. So Patrick, I mean, this is a powerful and I think very underutilized service within what ABS has.
It is. In fact, Eric, it just dawned on me that any of our services could be used, like you said, to immediately start marketing to doctors without the licensee having to know a thing about
Correct.
billing or coding, right?
That's right.
These are what we call door openers, but they're also very useful to the doctor's office. You can protect the doctor from audits from Medicare and save them thousands of dollars in fines, and you make money on this service as well, of course.
Absolutely. And the other part about it is, what if a doctor says, let's say Deborah's on here today, or Dominique, and the doctor says you exit out of training of ABS, and you finally got that appointment with a doctor, and the first thing that the doctor asks you, can you do my coding? And you go, yes, I have certified professional coders that will do your coding.
That's right. And these are people who've been trained, and yes, they've gotten certification for the coding that they've learned about in their schooling. And yet you don't have to do that. You see, it's because it's outsourced to them. They charge a fee that you pass on to your client, of course, and then you are marking that up so that you actually make money on all that as well. But again, it gets you into what I say, past the gatekeeper. That's the person at the doctor's office that might not want you in the office. And yet with all these different services that you could approach them on, one every month for a year, Eric, right? 12 different ones. We could offer them one different service every month that has nothing to do with the medical billing. We're not going to take that away from you. We're offering other services. So you see, it's like getting your foot in the door.
Correct. Yep. Getting your foot in the door, getting some money flowing, and all again to get that return on investment within the first year. On top of that, we've introduced two new services within the last 6 months. They're not new really anymore for us, but as Patrick says, we're actually offering new services like credentialing and some other things. And matter of fact, Patrick, I think you're actually working on a brand new marketing service that'll be rolling out pretty soon, which is going to be phenomenal. But these two services, a lot of people ask, hey, can I do dental billing? What if I know a dentist and I kind of know dental billing? I don't want to be just limited to medical billing. ABS has pulled the rabbit out of hat again and got a group that says, yes, we will work with you. We'll work with your folks. We'll teach them. We'll train them. We'll teach them to use our service. We'll help them get going on with a doctor. And that's all in dental billing. So folks, if you want to get involved into dental billing, you can see there's a one-time setup fee of $169. There's a monthly fee of $229, but the potential that you can be getting out of that is there's a setup fee of $2,000 to $5,000 setup. But then again, you're charging the doctors 5 to 9% on their total revenue. you could be doing your return on your investment with just the dental billing part out of it. That's what you want to do.
Yeah, exactly. Again, Hamid, if you're still with us, that's right out of that resource that I told you about, the research guide. We're going to show you how to get that here in just a little while.
Yeah. And the one that I like some of the best is virtual care. I love virtual care. I'll say this, a lot of people, Patrick, you and I have talked about this on some other webinars. We know that people, when things like we just went through with a pandemic, some of the richest people in the world has come through whenever there's been a big disruption in the market. And obviously our pandemic disrupted a lot of things, but what comes out of it are new solutions. And Patrick and Adam and some of the rest of the team went out there and find what's called virtual care. And only thing about virtual care is what is known as remote patient monitoring. We've got it marketed under virtual care, but what that all it is whenever let's say a doctor wants to have a patient just exit, their office, but they want to keep up with their blood pressure, or they want to keep up with their oxygen levels, or they want to keep up with other things. That can all be done remotely now. And
Yes.
really, unbelievably, if a doctor needs to make a visit, they can do that, a telehealth visit. But let's say that the patient's blood pressure is out of range there. The first thing that happens is the patient is going to get called by a nurse, make sure that they're okay. And if they're going to say, check your blood pressure again, and if it's still high, then that nurse is going to call the doctor, get everything going through that. That's something that is unbelievable that the doctors can use. Now, the great thing about it for the doctors is that they are going to make money on top of this as well. So there's an increased revenue, an annual percentage. If the doctor's only following 250 patients, that doctor could be making another $210,000 a year on remote patient monitoring, folks. That is unbelievable. And you're still not even doing the billing just yet. Now, let's see what you can make following that same 250 patients. If you've got, sorry, this is if we're following 350 patients, each one is going to be making, you're going to be making $7 on each of those patients per month. And your monthly will be about $1,750 a month, with that being another $21,000 on top of you doing something else completely. So folks, with virtual care, whether it's the coding, the Audit Guard, whatever it is, you're able to make money even not doing billing. So what are you getting for your $28,000? You're getting a truckload of ways to make money and get that done and get that ROI within your first year. That's what you're getting here.
Yeah, some people might refer to that as multiple streams of income, Eric.
Yes.
That's what we've got with each one of these services, folks. Whether you offer them or not, that's up to you. It's all optional, right? You can make that kind of money. Now, not the 21,000 from that one client. And Eric, the licensee doesn't do anything. They don't.
Yeah.
They don't
you're
do
really
anything
not doing much.
That's something that's billed on the back end to the doctor, and that money's paid directly to you just for having found the client.
And then one other thing, and then we're going to get to some of your next steps here, is what else you're getting. We mentioned the new thriving medical practice. And what's great about this is that we get to put your name on the front cover of the person that wrote the foreword to the book. And we've got one ready for you. If you want to write your own forward to the book, you can. But this is, Patrick, the best marketing piece I think ABS has ever come up with.
Well, yeah, who can beat having you as one of the co-authors of a book? Well, not really a co-author, although you write the intro, but it's just an introduction, right? It's just a forward. But the point is that your name is right there on the cover of the book with Dr. Vicki Rachter. Now, folks, that's worth a lot of money right there. Eric, we probably ought to be charging a $29,000 fee just for people to have their name on the cover of a book with a doctor.
Yep, absolutely. And then finally, you're getting your training. You're getting one-on-one with a certified instructor. It's based upon your schedule. There's 10 modules that you go through, and you can even have other people join you if you want to, that's going to help you build your business.
Yeah.
And again, that's all part of your one-time investment. And then you're getting certified as a certified medical revenue manager. And then you get part of the MERMA group, which is the Medical Revenue Management Association of America. Man, we packed a lot in an hour, Patrick. We got about 4 minutes to try to wrap this webinar up.
Okay. Well, all right. So let me talk about the guarantee, folks. A few years back, I decided that if this wasn't what you thought it was, because we misled you in some way on these webinars, I wanted to give people their money back. And so that's what we started doing, Eric. And people thought I was nuts, of course, when I started that. But I just think that's the honest, open way to offer any kind of business opportunity, because people can't know everything about it until they've gone through some of the training. We let you go through all 30 days of the training completely through it. And then you decide whether or not it's what we said it was, and we give you your money back. That's happened a few times, rarely, but a few times in the past. And so that's just a part of what we offer now. Yeah.
Yeah. And so let's talk about your next steps. And there are 6 steps that you can take. The first one is the research guide. Patrick, you've been talking about the research guide this entire webinar.
Yes, I have. And you know why? Because I wanted to be able to show the thing in front here. Let me see if I can get this up here and show this. This is what I call the research guide. There it is. I printed it out just so people could see it. It's actually a PDF that you get, but I don't know if this is going to show or not with that blurry background there. But as you can see, we've got over 65 pages now in this, Eric. And when people download this, they're going to learn a whole lot more than they would just on the website. We only want people who are serious about getting in this business to offer this to them. And so you just ask your ABS rep for this. We'll give you their phone number here in a minute.
You bet. And then browse our YouTube page. If Patrick and I and Adam and Jason, we've been doing webinars for years. We've got more information up there. If you want to learn how to do marketing, if you want to know how to do billing, you want to see interviews with other licensees and how their success, how they got their return on investment in the first year, this is the place to go.
Right. Yeah, lots of good information there.
And you need to talk to some licensees. There's a reference list that you can get. As Patrick has said in the past, Patrick and I can just be blowing a lot of smoke to you, as we do today, I guess. But talk to these folks here. These are the folks that you really need to talk to, people that are actually in the business.
Yeah. Yeah, these are actual business owners all over the country that have just agreed to take a phone call from people like yourself who are looking into the business. That's how open and honest people are about this business, because each one of these people might not have but 4 or 5 doctors, Eric. They don't need that many to make a real good living. And so they're not afraid of competition. There's almost 1 million medical providers in the United States. So.
Yeah, absolutely. And a live demo. If you have not seen the iClaim and the EMRX demo yourself, you're selling yourself short. You need to get with your business coach here, your business rep here that you're working with here at ABS, and have them do a personalized demonstration of the software so you can see it firsthand. So because that demonstration that you'll go through is a very similar demonstration that will help you get your doctor.
Right. We'll do these demos for your doctors. You can be on them, of course, so you can see and hear everything that's said. But the point is, we'll do that for you at no extra cost. That's a part of your license fee, folks. And we'll do an unlimited number of those. Absolutely.
Purchase agreement. It's a 4-page purchase agreement. Even if you're just considering, I would ask for that so that you can kind of start putting your whatever you need to kind of get through. And if you need to let your attorney look at it, please do that. And then lastly, send it in so you can get your training done. Hamid is asking Patrick, what is the length of the training? You want to answer that while we're kind of got this up here? Uh-oh, you're muted.
That's
there
up
we
to
go.
You and your instructor. You're going to actually get with your instructor, and y'all are going to set the schedule according to your schedule, Hamid. In other words, that's something that you and the instructor work out And it could be that you do the training all in 3 weeks time. I mean, it's possible, under 30 days for sure, if you want to get through it. But that's up to you. And each one of those sessions is about 60 to 90 minutes. So it just depends on what your schedule looks like.
Absolutely. Yeah. So it could be as short as 2 weeks. It could be as long as 3 weeks, but you got 30 days to get your money back. So as long as you get that training done within that 30 days, that could be how long I guess it could take you to get through that.
Okay,
Absolutely.
Eric, thanks for putting this together. Lots of good
My pleasure.
information here.